For decades, people have debated whether animal protein is harmful or helpful when it comes to long-term health. Some have argued that meat and dairy might increase the risk of heart disease or cancer, while others have pointed out the essential nutrients these foods provide. The latest research brings fresh clarity to the conversation. Normal amounts of animal or plant protein don't increase the risk of dying, and animal protein could even lower the risk of cancer-related deaths. The study used data from NHANES III, a large U.S. health survey that tracked diet and health between 1988 and 1994, with deaths monitored for nearly 20 years afterward. In total, it included about 16,000 adults over the age of 19, with roughly 3,800 deaths during the follow-up. To get a clearer picture of long-term eating habits, the researchers estimated people's usual protein intake instead of relying only on 1 or 2 days of food records. They looked at both animal and plant protein intake and measured IGF-1, insulin-like growth factor 1, in some participants. Because IGF-1 has been linked to cancer risk in past research, the team wanted to see if it affected survival. The results were consistent across different health outcomes. Overall risk of death, there was no connection between higher intakes of either animal or plant protein and the risk of dying from any cause. Heart disease deaths. Neither animal nor plant protein showed an effect on cardiovascular mortality. Cancer deaths. Animal protein stood out here. Those who ate more of it had a slightly lower risk of dying from cancer. Plant protein showed no significant effect. IGF-1 levels. The hormone IGF-1 did not show any association with higher or lower risk of death from any cause, including cancer and heart disease. These findings remain true even when the researchers looked at different age groups. Notably, in middle-aged adults between 50 and 65, animal protein still showed a modest protective effect against cancer-related deaths. The study suggests that the common concerns about animal protein may be overstated, at least when looking at usual levels of consumption in the U.S. diet. In simple terms, eating meat, poultry, fish, or dairy products does not appear to shorten life. On the contrary, when it comes to cancer, a higher intake of animal protein may even reduce the risk of death.